Thank you, Mr. Chairman. I think Dr. Thomas, I wanted to, you involved with government accountability officers in charge of audits, correct?
I'm sorry, say that
You
again.
in charge with, you involved with audits of government, right?
Yes,
As
we
part
are.
of, yes, okay. So I'm a former auditor, spent over a decade auditing publicly traded and private companies. Do you think it's common sense to have authorization of transactions? That all transactions that government disperse should be properly approved and authorized?
Yes, it makes sense.
That's right, right. That's what DOJ is trying to do. They came and say, okay, we need to make sure that transactions are properly authorized. This is accounting 101. Do you think it's proper to have justification transaction? What is the reason this transaction was disbursed? Is it based on some invoice, appropriations, and have all of this process? This is its common sense accounting.
Yes, we support the appropriate
Okay,
documentation.
so that's right. You have documentation. That's what DOJ is trying to do. Do you think it's appropriate to have automated controls and matching of databases to make sure that the things when we disburse transactions have some way of controls, and including maybe some automated controls? Do you think that's something that government should do more?
That is a much more challenging question. The automation is entirely dependent upon the algorithm.
But do you think we should have controls with manual matching or automated that matching controls to match data to have some controls in transaction? Do we have to have controls? You support having controls.
I thought your question was about automation. I apologize.
That could be automated controls, could be manual. I mean, but do you
Manual
support controls, right? Do you think you in charge of automation, do you think it's sufficient technology to have more automated controls?
I don't know if we have an answer to that right now.
You don't know? So we studied a lot of controls, I don't know, 20 years ago when I was in audit, private companies were able to do this. We actually did artificial intelligence and continuous auditing done in private companies. Do you think government cannot do it? You're in charge of technology and innovation. How far we need to go? How many decades behind you think government should be from the real world?
Within the science domain, which is my area of responsibility, the science right now does not support artificial intelligence that is deterministic. And that is the challenge that exists for using artificial intelligence for deterministic choices like you're talking about.
No, but just for simple transactions, you know, we're using just to identify fraud because that actually gives more efficiency. Don't you agree that actually continuous auditing and using more automation would detect and prevent fraud more efficiently than manually?
We do continuous auditing is a practice that we also enjoy.
Right, and I think that's what DOJ is trying to do. So they try to improve control environment to avoid to have, you know, so I'm not sure why there is an argument even about that if we try to improve. It seems like everyone wants to have efficiency and better auditing, that the things go to proper causes. And we need to simplify. Don't you agree we need to simplify our billing?
So your first statement was about the actual technology, and that is what I'm here to talk about.
Okay.
We do not agree across everybody that the existing AI technology can make error-free determination in an entirely automated
Well, there is no one can do error-free, but that could be tools and mechanisms to help us, you know, to be able to detect fraud and have more controls. Yes. You know, there is no proof, but it's less likely to have some set up system. So I think that's extremely important because we're spending a lot of money in healthcare, but we need to make sure that it's actually bring value. But there is a different conversation. It's a little bit broader, you know, not just fraud that we need to make sure that not happening, but abuse of the laws because Congress write very broad laws. And unfortunately, this issue became very partisan, where it used to be overbilling by large hospitals of Medicare was a bipartisan issue, or abuses in Medicare Advantage was a bipartisan issue, or in Medicaid, you know, Vice President Biden at the time was calling Ponzi scheme some of the, you know, gimmicks, you know, that hospitals play with provider taxes. And suddenly it became very partisan, and now we cannot have a discussion about the fraud and abuse because everyone wants here to make sure that people have better benefits and better health care. And because we're spending so much money on healthcare, but we are not getting outcomes and for value. And Dr. Miller, you as a doctor here, what do you think would be a key issues that we should address to improve healthcare value?
I would say automation to eliminate improper payments, so that way you're either saving money or you're redirecting that money towards other items and services for beneficiaries.
Okay, so it seems like we should be much more bipartisan support and agreement on this issue and not a partisan issue, because we want Americans to be healthy, because a healthy nations, that's the only nations can be strong. But thank you, and I yield back.